I think this is a disease that we've heard a lot more about in the last 10, 20 years. Is it because we're something people are doing and not eating properly? Is it something that we're be able to recognize better with all the symptoms and diagnose it better? Why are we hearing so much more about this in the last couple decades?
Well, 7 years ago, I started the National Foundation for Celiac Awareness to raise awareness of celiac disease because it is the most common autoimmune disease and most underdiagnosed. And the National Institute of Health ran a consensus conference at that time, and a whole group of physicians got together. And it was celiac disease before 2004 was considered a rare disease of childhood in the United States. 2004, it was reclassified as a common disease. So the disease itself actually got reclassified, which is, so then we said, okay, well, how do we raise awareness? How do we train the physicians? So we set out to launch a continuing medical education program on celiac disease and then launch a national awareness campaign. And at the time, we worked with Heidi Collins, who was on CNN, and she was a newscaster. And so you're having more awareness of the disease because the disease was reclassified. But then we also then started to work with the food companies and the grocery stores. And because even if you got diagnosed, 18 years ago when I was diagnosed, there was no food. I couldn't go to the grocery store. So when my doctor diagnosed me, there wasn't food available. So he said, you've got a horrible diagnosis. And I knew that if we could really increase the availability and the affordability of the food for people, if we got the 3 million people diagnosed. So we set out with the goal of getting 1 million people diagnosed by 2015 so that we would count and our voices would be heard. Now, then what else has happened is there's been a number of people, of celebrities, and sports stars who've gone on a gluten-free diet, and some of the celebrities are saying they're losing weight on a gluten-free diet. So you have some fad things that are going on here, and sometimes I think, how did this serious autoimmune disease become a diet fad? But it's not a diet fad. It's not the low-carb diet. It is a serious autoimmune disease. Also, the prevalence of the disease itself is increasing. So the Mayo Clinic did a study on that, and from 1950 to today, there's actually 4 times the number of people with celiac disease. So again, 30 to 40% of the population has a gene, but what was 1% of the population who would get celiac disease, we're now seeing an increase in that.
What can that be attributed to?
There's several theories. One is the hygiene hypothesis, and again, we need more science, we need more research to understand, and that is the fact that we have that we're very clean, we're in a very clean environment. So we're not fighting infection, so our bodies, are, because of the clean environment, so we have an overactive immune system. So that's actually being researched in some of the Scandinavian countries, this hygiene hypothesis. The second is looking into the fact that we're eating so much more gluten. Or is it the fact, so you look at the typical child, how much, carbs are they eating today compared to 1900? We're eating a lot more processed foods. And also the gluten is stronger, so the bread is fluffier. So is it something that we're doing with the modification of the gluten itself to make it more powerful that's setting off this autoimmune reaction? So we don't know, but those are some of the philosophy, those are some of the research initiatives underway.